Living well on Light Rock, it's been a foregone conclusion that carpal tunnel syndrome is caused by keyboarding or typing, but that may not necessarily be the case. Here to clear it all up for us is Dr. Kevin Lutsky. He's a wrist and hand surgeon with the Rothman Institute. First of all, what is carpal tunnel syndrome?
Carpal tunnel syndrome is caused by increased pressure within the carpal tunnel. It causes pressure on a nerve at the wrist called the median nerve at the wrist.
What is the cause of carpal tunnel?
Anything that increases that pressure. And so a variety of medical conditions can be associated with it: diabetes, hypothyroidism, pregnancy, rheumatoid arthritis. But most commonly, carpal tunnel syndrome is idiopathic, meaning there's no specific cause.
So you'll feel tingling, a little bit of pain?
Correct. People generally have numbness and tingling in the thumb through the ring fingers. Sometimes it's the whole hand. It very commonly wakes people up from sleep at night and they have to shake out the hand.
What are some of the treatment options?
Usually as an initial step, we'll have people try wearing a wrist splint at night. That helps keep your wrist in a nice straight position and helps keep the pressure off of the nerve. A lot of times we'll get EMG or nerve conduction study tests to really assess the condition and assess the severity of it.
And if that doesn't work, then surgery is the next option?
Surgery is a good option for carpal tunnel syndrome. It tends to be very good at helping with the nighttime symptoms and helping to prevent this from continuing to get worse.
And the surgery is relatively easy, isn't it?
It's generally very straightforward surgery. It takes 10 to 15 minutes at most.
And what's the recovery on it?
Typically very quick. People are generally back to regular activities within a day or two, and depending on their work, back to work within a few days.
One of your most common surgeries?
Absolutely.
All right, and it's good to know that there is treatment option, and we should say that if people are feeling this, it could cause nerve damage, and they might not even be feeling a lot of pain.
Yeah, that's true. So anybody who has symptoms should definitely have it checked out.
Absolutely. All right, thank you so much, Dr. Kevin Lutsky of the Rothman Institute, and you're living well on Light Rock 96.9 WFPG.